Hello, my name is Dr. Yim, and I'm an oral maxillofacial surgeon here at Let's Smile Dental. Today, I'd like to talk to you a little bit about your procedure before we get started. This is regarding extraction of your teeth under sedation. To be prepared for sedation, there are a couple of things to prepare for. Please make sure you don't eat or drink anything for 8 hours before your surgery. Some special cases, I may ask patients to drink water and only water for 2 hours before the surgery. Please also use any preoperative medications before your surgery as directed. If you are taking any medications for blood pressure or antibiotics were prescribed, please take them as instructed. On the morning of surgery, take those medications with a small sip of water, and please notify us of which medications you have taken and why. After your surgery, you will not be able to operate any vehicles or heavy machinery for 24 hours. It's also the same for any activities that require reflexes, so any bike riding or skateboarding should be refrained. Please bring someone who can drive you home afterwards the surgery, as well as someone who can stay with you in the reception during the surgery time. Before your surgery, please brush your teeth vigorously and clean your mouth before the surgery, and remove all makeup and contact lenses before the surgery as well. During the surgery, we expect to have access to your arms and your chest for monitoring purposes, as well as to give you medications to put you to sleep. Please be paired with wearing short sleeve shirts that are loose fitting, that we can have access to your arms and chest during the surgery. If you are experiencing any cold, sore throats, or upset stomach on the day of your surgery, please give us a call at a time so that we can reschedule your surgery. It's always better to be safe than to come in with symptoms of cold or COVID, and we will try to get you scheduled as expediently as possible. Moving teeth is a permanent process, and it is something that is hard to reverse. Whenever we do extractions of teeth, there are several factors that I like to talk about. Most commonly for most patients, you will have some bruising, bleeding, and swelling after the surgery. Some soreness and pain is expected after the surgery, and it is expected to take a couple of days to weeks before everything is normalized. Most likely, you will have bruising and swelling that happens and worsens for the first 2 days after surgery. Usually, after the third day of surgery, things will start to level out, and after a week of the surgery, you should start to feel much improved. After 2 weeks of the surgery, you should have small holes inside your mouth, but otherwise should feel perfectly normal. Also, it is possible to have trismus, or limited opening of your mouth, for 2 weeks after the surgery. Don't be surprised if you have difficulty opening your mouth wide, and just give it some time for everything to go back to normal. You may also have some cracking and bruising at the corners of your lip. During the surgery, we do have to open your mouth quite wide and stretch your cheeks in order to do extractions, and this may cause the stretch marks and the bruising. There's a chance of infection or dry socket that may happen after the surgery, and that may require additional treatment and additional visits to our clinic. Usually, dry sockets are pain that begins after a few days after surgery and need additional care from us, such as irrigations and of the application of medications into your mouth. I'm very excited to meet you on our consult session and to discuss about any specific questions you may have about everything we just talked about. Welcome to Let's Smile Dental.